This is Bernadette. How are you today? If you don't know me yet, I'm a London-based nurse and I traveled to Budapest, to Hungary, to get my breast augmentation done, and the operation was 4 weeks ago. If you want to know more, I have had a few short videos uploaded here in YouTube about how I chose my clinic, how my surgery went, and how the first 3 weeks of recovery for me was. Today I would like to talk about breast augmentation infection, because of course an infection is a possible complication of any surgery, and breast augmentation is not different to that. According to Google, less than 2% of any cosmetic surgery result in infection, so I can be considered as lucky. I was of course in the 2%, and I just want to tell you on how my infection got to the surface. An infection can be caused by bacteria entering through your surgical wound if it's not kept clean and dry, and it's not properly looked after. After your surgery, your doctor will tell you how you have to look after your wound. Every person is different, so it can be vary. But please just listen to what your surgeon says and follow the instructions they give you. Also, it can happen, an infection can occur when bacteria enters your bloodstream, or also it can happen if a bacteria enters your breast tissues, and because you have the implant, either is silicone or saline, but it's a foreign object to your body, so your immune system won't be able to fight against it, and so bacteria can plant itself on the surface of the implant. And most cases this infection can result in having an antibiotic course for 10 days, 5 days, whatever your surgeon says, and it can go away as simply as that. Every infection has symptoms. The most common symptoms are like having fever, nausea, flu-like symptoms, feeling tired and drained and having no energy, cold sweats due to having fever, severe pain in the breast tissues. Deep down you can feel the pain in your breast, and also it can have swollen, the tissue itself, the breast can be swollen, it can be hot to the touch, it can have redness, might your nipples crack a little bit, also it can, the wound can open and projecting, having dripping breastway or infected fluids. So what happened to me, guys, was on my 3rd week post-operation checkup, everything was perfect. My breasts were looking nice, the skin was perfect. I had no symptoms whatsoever of having any infection. I had no fever, I had no pain, I was absolutely fine. I was already up and walking daily about 5 to 10 k's. Nothing unusual happened, I would say. And on the 3 weeks checkup, the doctor had moved the implants around a little bit to make sure they're not tied down under the muscle, the pectoral chest muscle, which is an absolute standard procedure to make sure they will moving around and they will drop into their place. And the doctor told me that from that day on I can start gently massaging the breast and the implant side of the tissue to make sure they will drop nicely. My wounds were absolutely healing in a good pace, no issues. After I got home from the clinic, I had fever that night. It was 30.2 Celsius. I felt really tired. I had no appetite that night, and I woke up in cold sweats. But I generally thought it was just a reaction of the muscles, because of course the chest muscle won't be able to heal in 3 weeks having a surgery done. So I generally thought it was just a reaction of the muscle. However, I wrote an email that night at 1 a.m. and then I followed up with a 4 a.m. email to the personal assistant of my surgeon to let them know I had temperature, I had slight pain in my breast, both right and left, and then I was having cold sweats, and I had a lower blood pressure because I was monitoring my blood pressure also. But however, I felt absolutely fine the next day, which was a Friday. So my checkup happened on Thursday. I had fever and all I just mentioned on Thursday night. By Friday, I was absolutely fine, had no issues. So I generally thought it was just a reaction of the muscle. And then the surgeon said not to massage the breast, and if I had any symptoms of pain or fever, to do attend the clinic on Saturday at 8 a.m. Which I responded on Friday night that I don't think I needed an emergency appointment because I was absolutely fine. On Sunday, I went out to see the 17th annual Pumpkin Festival with my family and friends. We walked around. I was in a good spirit. No issues whatsoever, nothing. Every night I had shower. I redressed the wound. It was, picture perfect. I was happy. And then on Monday, 4 days after my checkup with the surgeon, I had no pain, no fever, my breasts were fine for the touch, I had a good appetite, I slept well, I was in a good spirit, I had my daily walk, nothing unusual happened throughout the day. I did not lift anything, I wasn't bending down, I wasn't doing any housework. My daily walk was my movement, nothing else. I was really still careful because after the surgery the doctor said that I shouldn't do any exercise for 6 weeks. So I was really, keeping myself to every single word he said to me. However, on Monday night when I was going to have my shower and I took my top off, I could see that I had my bra soaked in a brownish discharge. Of course, I freaked out. I took the bra off, I took the sterile gauze off of my breast, which I covered the wound with in the morning, and everything was soaked in this brownish, yellowish discharge which had no smell, and I could see about this much, like a half a centimeter opening on the skin. Not the wound itself, I wasn't able to look into it, so the skin itself opened, not the surgical wound, and I had this brownish fluid dripping like a broken tap from my left breast only. My right was absolutely fine, no issues. I still had no pain, I had no fever, I had no redness on the tissue, I had good appetite, I could sleep well, I was not nauseous, I wasn't tired, nothing of the symptoms of an infection occurred at all, apart from the breast having dripping like a broken tap, like I said. So I panicked, I called the hospital, and I got in touch with my surgeon who gave me an emergency appointment for the next day, because of course it happened at 9 p.m. guys, the best time ever. Everything happens at late night or late evening. During the day everybody's always fine, of course. I know that from my career as a nurse. Everything, all emergencies happens at night. So next day came, I was still fine, no fever, no pain, nothing. I attended to my appointment at the clinic. The surgeon took a look. I think he said to me that because in previous night I sent him a few videos and pictures of what I'm experiencing, and he thought that we might have had to walk into the theater for a second surgery to stop the infection, because in some cases an antibiotic course it's not enough. They had to reoperate on the infected breast, which means they had to open up the wound, take the implant out, clean the surface, put the implant back. I'm not sure if it's the same or a different implant, but they put the implant back and then close the wound, and they give you a drain for 3 days, 72 hours to get rid of the excess fluid. But luckily, after he examined the wound and the breast itself and asked me if I had any other symptoms by this leakage, he said he will give me 2 new stitches just to stitch the skin itself up, and gave me an antibiotic for 10 days to take, and it was the Avelox 400 milligram. I'm not sure if you can see, and it contains moxifloxacin. Had to take it for 10 days. Every day has to be taken on the same day. And while I was doing that, for the first 3 nights, I had to send him a message after he provided me with his personal number or work number, either way. He asked me to report on how the day went, if I had any symptoms, any pain. So for the first 3 days of taking the antibiotic, I was taking my temperature twice a day, and I was taking my blood pressure once a day. I was absolutely fine. I still had no symptoms, guys. No fever, no pain, no redness, no hotness for the touch. I was able to sleep on my side. I had good appetite. I was energetic. I was still doing my daily walks. I was fine. Honestly, nothing happened to me apart from having a leakage from my breast. After I got in the new stitches and the antibiotic, that literally the leakage stopped right away after having the stitches. And I had texted him each night, reported that I was completely fine. However, on Tuesday was the emergency appointment. 2 days after, on Thursday, I did see him in person as well. He said that we were still not out of the woods, and he wanted to keep a close eye on me to make sure the antibiotic works as it should, and we wouldn't need a second surgery, which he really did. He really kept a close eye on me, and I am so grateful to him. I think I have chosen well. The clinic is sparkling clean, and this doctor is the best doctor I have ever come across. I mean, one of the best. I haven't been working in healthcare sector for 14 years, and I have had worked in several departments, worked for the ambulance team. I have had 3 years of placement before my diploma. So in total, in these 17 years of my nursing career and school counted in it, I have come across a few doctors like him who do have the knowledge and they care. He is a fully human being who cares for you, who treats you incredibly well, who understands the patient, who wants to hear what the patient has to say, and who takes the time. Doesn't matter if it's 9 p.m. or 10 p.m. or midnight or whatever, it's Sunday or Monday or whatever, he takes the time because he cares, and his knowledge is unbelievable. Of course, he told me exactly why I have got the infection, but to be honest with you guys, when on the emergency appointment he said we might walk to the theater for a second operation and the 6 weeks starts from there, I kind of got into a state of shock, and I only remember every third word he said to me. I'm fine now. I had a checkup yesterday. The antibiotic was fully working. I'm out of the woods. I have to report to him if there is any problem. I can message or call, and my next checkup will be in 2 weeks from today, when he will remove the 2 stitches and check on my breasts. And if everything is fine, I can start massaging them. And most importantly, I will be able to go back to London and start working. And now he said I can start moving around, so I am continuing my 10k walks each day. I'm drinking plenty of fluids, 2 to 3 liters of water daily, and I'm having a half a liter of smoothie. I'm still taking my vitamin E and vitamin C and cod liver oil to have the skin help, because of course the implant is still not fully in its place. I love the girls, they're beautiful, they are perfect. And I'm using a sweet almond oil and also a vitamin C serum on my skin after each shower to keep the skin hydrated. And I just wanted to tell you guys that an infection after a breast augmentation, because it's a surgery, it can occur in the first 3 weeks. And it doesn't always occur by having a fever or pain or redness or nausea. It not always makes you tired or lose your appetite. It can happen with none of those. So just make sure you keep your eyes on your wounds. If you experience more leakage than 1 or 2 drops in every 24 hours, and if you have to change your dressing more than once a day, I would say, please do call on your surgeon, because it can happen. It can happen like happened to me, that one day everything is fine, and next day it's a little skin opened up and having a little dripping. It's not normal. Even though if you don't have any other symptoms, please do call your surgeon. Go and get them to see you. Follow every advice. And when you take antibiotic, girls, please do buy probioticum at the counter of the pharmacy. They not require prescription. But of course, when we take antibiotic, it's kind of, messing with our system down below. So if you don't want to have a thrush develop, then take probioticum with your antibiotic. Just make sure, or if you decide not to, eat yogurt each day, twice a day. Eat as much as you can, just to make sure you're not developing a thrush, because the last thing you want is, after you're finishing your antibiotic course and your breasts are healed and you're happy, you have to go and see a gynecologist to make sure down there is everything is fine as well. So just, it's a advice. If you want to take it, of course. I'm not forcing anyone. Oh, and just as a disclaimer, I have talked to or emailed. I haven't talked to the clinic in person. I have emailed the personal assistant of the surgeon to ask permission to mentioning the clinic and his name, and of course I'm still not being honored by any way. There is no gratitude from anybody's side. I'm still doing this video and all of the videos to spread awareness and knowledge that sometimes things can happen even if you do your best, and the clinic you went to, they do their best. And just please make sure that you find a team and a surgeon who is willing to be there for you, even though after the surgery is done, who actually cares, who checks up on you, who generally wants you to be better and generally wants you to have self-confidence and feel good. That's all I wanted to say today, guys. I hope you enjoyed this video and have a beautiful day. I'm just gonna go and have my walk today as well. If you have any more questions, please do ask, and in the description box I mentioned the clinic and the name of my surgeon, and I have put 2 articles there for you to read, one from Dr. Rose, the clinic I went to, and the other one is an article on breast augmentation infections. If you have time, I think it's always good to gain more knowledge if you are thinking about having a breast augmentation done for yourself. So this was it for today, guys, and have a beautiful day. See you in 2 weeks. Bye.